And next up, I'm going to introduce Toby Ewing. Toby Ewing is a consultant at the Senate Governance and Finance Committee, and he is going to bring on his panel to talk about policymakers and data. Toby.
All right, thank you very much. I guess I get to sit. We're going to have our panelists come out and join us. So, I know it's getting late in the day, but there were some conversations earlier about how do you turn this into action, and so you heard some of that at this last panel we had. There was late but not least here. Prior to the fireside chat, some discussion of, okay, we've done the best data visualizations, but how do we actually turn that into action? And so one of the things that we want to talk about is policymakers and data. And in the presentation, in the guidebook, it says, God, how do we get their attention? How do we actually get this information into their hands? Lori Cappy's nodding her head over there. Yeah. So she's got that armband from waving her hand so hard, she broke her wrist. So we really had some good presentations today about some of the data, the tools, and the engagement. And one of the ways that I want you to think about, or that we're going to think about this, is that there really are those three components. Some of the conversations are about the data that we have. How do we get better data? How do we get access to the data? How do we tune the data? How do we get it in formats that make it more functional and effective? Some of the discussions today have been about the tools, the quality of the visualizations, whether they're dynamic or as simple as that cholera graph that Andy showed us. And then this third issue is what I call the political capital. How do you actually take those tools and apply them in a way that actually matters, that bringing data to action, information to action. So we've got three presenters today who are going to answer all of your questions, and if not, they'll refund your money. So we have Ron Spingarn from OSHPD. Who here is familiar with OSHPD, has used their data? Right? So Ron, to my far left, he's going to talk a little bit about OSHPD and the data. My notes say he has 150 million hospital patient records. And so if you were born in California, if you lived in California at some time, Ron can probably look you up. Abhi Nemani, Chief of Staff for Code for America, shout out for Code for America in the audience, right? So a few of you have heard of that, right? And then John Kim, Director of Healthy Cities. So, Code for America you know about. We're going to hear a little bit about the strategy that they've been playing. They have built this phenomenal peer-to-peer network. They're doing the kind of leveraging that we heard about a little bit earlier. So he's going to talk a little bit about the strategy that they've played. And John's going to talk a little bit about some of the social justice applications of this connection between data and decision-making and the impact on communities. And the challenge that I want to bring to the panel, that I hope you'll bring to the panel, is ask us to sort of, make real this conversation of why this matters. Because these are the folks who are doing it. From the state, on the administrative side, I'm with the legislature, from the nonprofit sector, both in terms of working internally, both of these gentlemen, with public agencies, and advocating externally to actually bring about the kind of change that brought you all to this forum today. So, Ron, with that low bar to get over.
Okay, let's see. Okay. Okay, so this is working great. So I'm glad to see so many hands and know about OSHPD. It will save me a couple seconds of my brief introduction here. So the division that I work for is the Healthcare Information Division, and that's our web address, and there'll be throughout the presentation our web address and contact information if you would like to reach us. So we're one of 17 entities under the California Health and Human Services Agency, and the Healthcare Information Division collects data from over 5,000 healthcare facilities licensed by the Department of Public Health, separate organization. We basically do three things. We clean the data, we collect the data and clean it, we release the data sets and subsets, and we produce analytical products. And I'm going to highlight a little bit about some of our data sets, and products that we have. So I'm sure you all have heard about the healthcare reform in 2010, and really one of the reasons I wanted to come today is really just to let you know that our data is almost entirely free. There are some that we do charge small amounts for, but we hope to let you all know that it's available and to help you use it in the future. So we want to promote it and let you know what's available. And I'm just going to give you a real small taste of what we have today and hope that you'll contact us afterwards for more information. So we have 4 kinds of data flows that are confidential. They're all hospital-based. They all come from hospitals. So in 2011, we had over 2 million hospital clinic patient records coming into our office, over 10 million emergency room or emergency department patient records, 4 million hospital inpatient records, and 20,000 heart surgery records. Now, these are confidential data sets, but we provide subsets and custom data runs to people that are de-identified. So it's on the basis of these data sets, I'm going to show you a few slides about some of what can be done with it. So for those of you who aren't familiar, the Federal Agency for Healthcare Research and Quality, AHRQ, has about 50 quality measures. Preventable hospitalizations are one of the 50, and they're part of a suite called the Prevention Quality Indicators is one of the 4 suites, and the preventable hospitalizations is one of those within that. So these are using 2011 OSHPD inpatient data, the population data from the US Census, and they're age and sex adjusted, and you could see the variation across the state. Preventable hospitalizations are important even though they use inpatient data. They're an indication of what medical conditions are preventable if you get access to primary care in the community. So this is actually an indication of access to primary care. Another way of looking at the same measures by counties from low to high is here. Each of these bars is one county. The red bar portion of the bar are chronic conditions. The blue portion of the bar are acute conditions. And you can see the range from low to high across the state, for the counties. And the green bar is our current baseline statewide average, and the purple bar is an aspirational goal set by our Health and Human Services Secretary for 2022. Top 5 of the 12 preventable hospital conditions are listed here by their volume. Total charges, which we don't get paid claims, but we do get total charges, and the median charges per patient. So we also collect financial and utilization data, which are not confidential. They're 100% public. And these are the kinds of facilities that report the utilization data to us annually. Hospitals, long-term care clinics, long-term care facilities, clinics, home health agencies, hospices. We also get quarterly reports from hospitals. And the financial data come to us annually from hospitals and long-term care facilities. So those data sets, again, they're all public, can be used to do a whole variety of analysis. This shows the blue line are acute hospitals, the purple line are long-term care hospitals, red line psychiatric, green rehabilitation, and the light blue is all other, and shows hospital bed capacity and the range over the years. This shows hospital workforce data. It's also in that data set. The light green are registered nurses, the red technical and specialists, the light blue management, supervision, and so on. So we actually get to workforce issues in that data set as well. And hospital bed occupancy rates, again, by hospital type that I mentioned earlier, you can see that there's variation across the years. And I want to give a shout out to one of our tools that we have, which is a GIS web mapping tool. And Mike O'Neill, who's in the audience, is behind that tool. And it brings together a lot of those data that I showed you and more in a GIS web mapping tool that's on our website. And happy to answer questions after today, or if you'd like to contact us, that's our contact information. And that's all. Thanks.
All right. You're up.
Should I go over here? Let's see if this gets going. There you go.
So I should just start by saying two clear things in terms of transparency, since we're talking about open data. One, I apologize. I realize this panel is one standing between you and cocktails and dinner. So sorry. We'll try to be brief. And then second, I'm actually not going to talk to you about healthcare data. Code for America, as you might know, works in a lot of different fields, and I'll explain a little bit of what we do. But we specifically try to focus on broader innovation in various different sectors. So sometimes it's healthcare, sometimes it's education, sometimes it's potholes. It depends on various different things. And I thought, and I'm excited to talk today about how open data broadly is evolving, how to leverage that for policymakers, and what might make sense in terms of healthcare. So I hope that's OK. Just because I didn't see a lot of hands go up in terms of when was asked what Code for America is, I thought I'd give a quick overview. So we started a couple years ago. We're a nonprofit. We're a Peace Corps for geeks. And the idea is that doctors can do Doctors Without Borders to give back. Teachers can do Teach for America. But how do technical talent, how do developers and designers who have really fantastic engineering skills give back to society to make cities work better? Well, we created a program called the Code for America Fellowship, where each year we work with about 8 to 10 cities on innovation. We give them a team of 3 to 5 developers who help tackle a problem. It ranges from, again, blight, which I'll talk to you a little bit about today, to healthcare. And you heard earlier today about human services, about one project we're working on in San Mateo. And it's those kind of challenges we think that technology can lend an interesting point of view. And that's what we try to do. So that's Code for America. That's what we do. And I thought today what I wanted to do was focus more about how we're leveraging technology to boost better outcomes for cities. And less on the side of what are the tools themselves, but more what the tools accomplish inside cities. Like, what do they make change? And so the first thing I want to talk about is, I think, how cities can leverage data to get more buy-in in terms of technology. So our process I described is cities give us big challenges and we start to figure it out. So this was one challenge cities wanted us to take on. This was Boston in 2011. Our fellows got there, and there was a huge snowstorm. And they're supposed to go look into how to innovate the education process. And they started talking to the school district. And they said, well, we can't really do any of that because we're answering phone calls right now about parents asking where school buses are, right? Because this is what happens when there's a lot of snow. Parents are like, where are my kids? And so our fellows are like, so what are you doing? They're like, well, we have these GPS locators on the buses. So we're looking it up when people call and giving the response back. And our fellows are like, how is that what you're doing? This is data that you're having, and then you're communicating that out by person. You should just create a mobile app that people can look it up and find out where those buses are. And cities like, no, that's way too hard. We're worried of the privacy considerations. We don't think it's possible to actually solve that problem. So our fellows went back, came back the next day, and built a prototype. They're like, actually, that's a solvable problem. And they solved the problem. They said, listen, you can do this. The privacy concerns are real, but we can solve for them. And they did that. And the reason I bring this up and the reason I think this is important is sometimes data is scary, right? Particularly publishing data is really scary. But so often you have to move beyond your initial knee-jerk reaction of this is a fear and think about how can I solve the problem. And what's great about it is once you can do that, once we show the staff that this was a solution, they said, oh my God, what else can we do with our data? And that's what's possible once you show people what's possible, right? If you can show a real use case of the data, they're more inclined to do it. So I guess my point is to policymakers, think about how you can use data to get more broader buy-in for future publication of data. I've only got a couple minutes left. So there's another way you can improve services. This is another problem that we got into in Boston that year. So this is the book. This is one screenshot of the book that is provided to parents when they're trying to figure out what school they should send their kids to. It's 38 pages long. I can't even read it from here, and I could imagine you guys in the audience what you can do. And so they got really frustrated with that, right? Parents are like, how is this the way you're communicating with me, my city? And the mayor was like, well, that's a problem. And so our fellows took this data, because that's data, right? They took this data and made it comprehensible. They made this simple tool. It's called Discover BPS. It's like a Yelp for school departments or schools. And they took this information that was previously really complicated for parents and made it simple and easy to use. But the really interesting thing is this. So the school had a rule that students could go to schools within 1 mile of their house. So a mile is, an understandable rule, right? And as a piece of data, that's a piece of data. The problem is, if your mile is across the Hudson River or the Charles River, it's a lot different than a mile that you can walk to. And the rules that they had didn't accommodate for that kind of complexity. And what's great about technology, and when you open up data and allow entrepreneurs and engineers to leverage that data, they can start thinking really creatively about, okay, well, a mile is an interesting metric, but maybe it's about 15 minutes walk time. So they actually built what's called a walk score into this map to understand how far it was reasonable for students to go to. And I think that's what's really interesting about open data, is it lets people innovate. It lets people think differently about the problem. And I just have a minute left, so I'll just stop with this, which is creating trust. This is the project we did in New Orleans. In New Orleans, a big problem is urban blight, vacant housing, because vacant housing are hotbeds for crime, right? They're really dangerous places in a city, and New Orleans, in particular, has a huge problem there. Well, the mayor didn't know all of the vacant houses within the city, and neither did the citizens. So they would have these things called blight stat meetings, which are kind of like crime stat, if you're familiar with them. They come together every week for an hour and talk about the problem. No one had the data, so it's like looking into a black box. And so what the fellows were able to do is open up that data and create a tool like this, which is what's blight status? What's the status of a given location? So you can look it up and find out specifically what the city is doing. And what's interesting about this tool was this. This is what an article said once they saw this application. The app proposes a new kind of more productive communication between the two groups that moves past angry and frustrated citizens on one end and paralyzed city on the other. It builds trust. And I think that's what's really interesting to think about when you understand how to leverage data. There's a way in which it can move beyond just faster processes or better engagement. It can create a better relationship between cities and government, cities and citizens. And that's what we're seeing, and I think it's an evolving field, but it's something exciting to take on moving forward. Thank you.
All right, thanks, Abhi. Go ahead, yeah. So I love that he mentioned building trust, because part of this conversation is about building trust in the data, in the tools, and in the conversation that happens with policymakers.
Good afternoon, everyone. So John Kim, I'm co-director actually of the Advancement Project. And just to give you some background on that, it's a national civil rights policy organization. I like to say that we're not your mama's civil rights organization. We have sort of rooted deeply in the values and focus of the civil rights movement, but understand that the universe has changed, the game has changed, and therefore the tools need to be updated. And so part of what we've been focusing on is how do we still create those sort of disruptive moments where it creates a space where society needs to look at spaces of injustice and actually address this kind of work. The thing about us is that we are an oddity in this conference, and a lot of times when we come to these kind of places, is that we're not a tech firm, we're not a research firm, we're not a university, we are a civil rights organization, so we come with very strong perspective and values and want to see very particular things change, and so that's what they asked me to kind of focus on. But as part of that, what we did is we started this project called Healthy City. You can find it at healthycity.org. The California Endowment and Hewlett Foundation funded us to take it from just covering LA County to the entire state in 2010. So, it's at a computer near you. And the idea, and I'll show you a little bit about the technology, but the idea is that we wanted to create a platform that really levels the data playing field so that it's not just government or large institutions that have access to data, but it's the communities themselves that can have access to data so they can make their own case for change. We also know that you can't make change just from a website, so we actually do a lot of direct engagement and partnership with foundations, community organizations, and government, because it's not just about what you can find, but it's about actually engaging in sometimes very hard political conversations that need to really move decisions and therefore move resources. And finally, we don't want to be the only geeks in town around this stuff, and so we've established this thing called a Community Research Lab, which really teaches folks, there you go, really teaches folks in community-based organizations how to utilize technology research to really push their agenda. There's the website, healthycity.org, really pretty. You can do all these sorts of things. Service listings, we have all the 211 data. A lot of talk about 311 today, but we have all the 211 data for about 20 counties, I believe, in the state. A lot of interactive, neat mapping, tools, and charts. And the other cool thing about it is that you can actually upload your own data, whether your own spreadsheets, you can take pictures, use your mobile phone and actually take a picture and it'll pop up on the map, and allow people to sort of curate and view and create their own stories. A lot of data. Those are service points, good and bad, in any community. A lot of population-level data, both good things and bad things, in communities around the state. And just a real quick rundown of what you can do. I could look at, in any place in the state, and this is in particular LA and South LA, the larger red blobs, and I think that's the technical term for those things, the larger blobs are where you see higher concentrations of families in poverty. This is now where you see actually the highest concentrations of firearm-related hospitalizations, those big red blobs. You would hope, as a region, as a society, we're smart enough to figure out maybe that's where we should put hospitals. But unfortunately, when you map that from our system, that's exactly where there's a sort of donut where there are hospitals. But maybe what we're saying to them is you don't need hospitals, but you need to medicate yourself some other way, and so there are plenty of alcohol outlets in those particular areas. Okay? So part of what you can really do with this data and this platform is to really tell a story, right? Not just tell a story with the data, but also to try and base it within a particular campaign, a particular initiative to actually change some of the conditions around you. Before I go on with this PowerPoint, I do want to sort of admit I may not look this way, but I'm actually 75 years old. I may not look it, but I'm kidding. But we've actually been doing this work for 11 years now. And 11 years ago when we started this project, there wasn't the open data movement. There was a you touch my friggin' data, I will cut you movement. Okay? So the fact that we have now, this whole new space where we could talk about executive orders and government and folks kind of coming together and saying, hey, what can we do with this data is phenomenal for us. But I will tell you, all of this is political. And we need to be very clear-eyed about it. When we started Healthy City, those 11 years ago, it was an advocacy civil rights group like the Advancement Project, the Center for Nonprofit Management, Children's Hospital, so on and so forth. And then the County of LA was actually one of our key partners. There was a senior person in the bureaucracy of the County of LA that loved this idea of creating this platform to share all of their data. And we'd have all these meetings, with candlelights, talking about how beautiful it would be if we share all of our data and all these great things would happen. And all of a sudden, out of nowhere, the guy disappeared. The guy said, I can no longer be a part of your partnership. And when we finally got to him and said, hey, what was that about? He said the board of supervisors got to me and said, we cannot partner with an entity like this, with an initiative like this, that it would put too much information out there. And it would basically disrupt what they call the rule of 5. There's 5 board of supervisors in the county. And regardless of where the need might be, greater in one area or the other, but they like to just play this game where they say $50 million comes in for some type of service. Much easier for them to just break it up by 5 and let people just sort of play out their little fiefdoms. And so to create a space where you can actually say, oh, really the problem is here, and maybe $45 million of that dollar should go in this area, that was too much for them. It messed with their politics. And so we need to be very clear about all of these innovations around data, all these innovations around technology tools. It's the beginning of the game we have to play. It's sort of painting the lines on the field, and we have to get ready to understand that the real game in front of us is how do you really push some of these old school ways of thinking, these easy decision-making processes, to actually use data, be straight up about where their needs are, and to actually move people to becoming what we elect them to be, which are statesmen or women, to actually make real decisions. I have a 6-year-old daughter. We had a party at our house, and she had some candy to share with her friends. And what she did is she shared it judiciously and evenly across all of her friends. And that's great for my 6-year-old. But I want my board of supervisors, I want my city council, I want the people who make decisions to be a little bit more nuanced than my 6-year-old. In terms of understanding the historical disparities that exist in our communities, to using data to show where there truly are needs, and how to actually use that, not only just the data and the tools, but also engaging communities and engaging the people that really are impacted by these decisions so that we can actually push and fight for change, right? So I had all of these examples to give, but I'm really afraid that guy's going to be dinging me with that very meditative bell. So I'll get off stage now. Thank you.
All right. So, at this panel, some great examples earlier in the day. On the issue of policymakers, one of the things that some folks will say, I think Dan Walters, a columnist in the Abhi, wrote once that policymakers don't need more data because they don't use data. The reality is that they do. They will take anything that you have if it supports what they want to say. Or if they don't have a strongly held position. I meet with some of the members and senators all the time and key staff, and nobody has once said, I was going to vote against that tax increase till I saw that spreadsheet. That research paper really changed my mind. So I think people have very strong ideological positions, and data slowly can change that. But it is best when you don't have a strong ideological position, when there isn't a lot of political resistance. And the good news is that there's lots of areas where we've made progress. Lots of diversity among policymakers, lots of opportunity, as you've seen in some of the presentations on this panel, some of the earlier panels. So one of the things I want to ask is, as each of you has worked with policymakers, decision makers at the state level, at the local level, or elected or not, what are some of the conditions that come together for a successful project? In other words, what does it take to actually translate the data and the tools into the action?
Anyone?
Well, we are the data source, so we try to be neutral in terms of our position, but it's really helpful if people who come to us know what it is that they're trying to point out, so that we can help them identify where there are gaps in their knowledge, where there's other data that they may not have known about. And so, it really does help to have a framework when you're beginning your project to understand what that is and what you're trying to say. So I don't know what you want to add to that.
Yeah, I would just say, I think in our work that we've seen that there are certain people that have beliefs about open data that are belief-driven, or fundamentalist was what I call them. They believe that open data is the greatest thing ever, and it's going to be awesome. And then there are people who are more pragmatic, right? How is open data going to help me do my job better? And what we've seen to be more effective in the long run is if you can position an argument for why to open up data or why to set up a project that's actually pragmatically useful, that's going to end up having a real ROI, saving resources, saving time. That's far more effective getting broad-based adoption than an argument saying, we should definitely open this data because it's the right thing to do, right? It's better to position in terms of a pragmatic, real outcome.
So as a civil rights organization, we're very sensitive to when we might be dealing with bad actors that may have malicious intent for the communities that we care about. But that's less and less the case. There aren't as many of those sort of bull connors that we've seen in years past. What we now do see is that, unfortunately, some of the systems that were developed to keep one particular group over another particular group were baked into the structures. And they were baked into the structures and created these sort of decision-making rubrics, like first come, first serve. Again, my daughter should be thinking about how to share her candy with her friends, first come, first serve. But if you're talking about, let's say, overcrowding schools, and how to relieve the overcrowding, and say, hey, we got a pot of money in the state to relieve overcrowding, first come, first serve, it's going to be the undercrowded, wealthier school districts that can hire consultants to get in line that are going to get that money. And that indeed was the case. And we found that to be the case under a Democratic governor. And it wasn't that he had ill intent about the communities that we cared about. It's just that there was some structures and some procedures that were baked into it. And so what data can do is to really not only open our eyes to the questions at hand and open our eyes to the injustice, but it really should set the table for a conversation. Because a lot of times it's not about good versus evil as much. It's about having a conversation to really build the partnerships to ensure that the community is involved, and to also establish a political analysis to say, hey, what is really behind these kinds of questions? So I really do see that in the conditions to really moving this forward, it's about the data, it's about getting the information out there, it's about having a political analysis, but it's also about setting a table.
All right, so earlier you mentioned trust, right? It's key to trust. I want to kind of reframe your comments a little bit about, you say make it pragmatic. I would say create demand, right? In other words, if it is useful for a decision maker to get something done, the key here is that they want to get done. Is that right? You also have to have that other element of trust. So can you talk a little bit about how you build that trust? So in other words, if the issue out here is, how does the audience translate the data that is meaningful to them into information that is meaningful for another set of decision makers, be pragmatic, but talk a little bit about your experience on the issue of trust, because what you're ultimately wanting people to do is to make a different set of decisions than they would have made otherwise. Is that right?
Sure.
Go ahead.
Okay. So I would go back to this idea of setting the table. That sometimes when you come into a room and you've already done all the cooking in terms of the research and the data and say, hey, we're all done, let's just tell you what to do, that doesn't work a lot of times. And so what does work is when you pose the question in a broad enough way that you can get multiple stakeholders to come to a room, to come to a table, and set the rules for that table. To say, hey, we're going to actually work to solve this together. Part of that's going to actually be doing some research, accessing some data, and that process we found time and time again can actually nullify some of the politics around some of those decisions. And so what we all have here as a group in this room is access to one of the most powerful political tools that we can really ever get our hands on, which is to do some work around the data, around the research, get people to the table to nullify some of the politics. And as you do that, you build trust across all the different sectors, and you have just that much more viability to come to a solution.
That's great. That's great. Abhi, I'm curious on that question. When you're approaching a city or when you're starting that conversation with a city, are there ground rules?
Yeah, no, it's a really great question. I mean, I think in terms of ground rules, one key one is that we don't cities can't come to us and say, build this app with these 7 features with a button in the top right corner that's green, right? Like they can't come with that kind of specificity.
Do they get to say, divide the $5 million evenly across the 5 Senate supervisorial districts?
No, they get to say, make sure our districts are well served in these 5 ways, and then we get to figure out what's the right way to do that. But I think to the question you're getting at, which is to say, how do you balance the interest from the people who are in power versus the more empirical or data-driven needs that are actually assessed by people on the ground? That's a really hard question, right? Because the way we built government so far, and again, this is more on the city bureaucracy side and less on the healthcare in particular, but the way we built it so far is that you write a large RFP. Who here has written an RFP, right? This is the way you buy software right now, right? You put out a software saying, these are the things I want, and then ask people to respond to it, and then go from there. Well, that's not the way most companies right now buy software. I run a startup right now, and I don't buy software through RFPs, right? And so this is the problem that has to be addressed with government, is that you have to start looking at the adoption and leveraging of technology in a way that leverages a real market. And what we're trying to do at Code for America, to that point, is to build a real ecosystem for what we call civic startups. We need a better phrase for it, probably. But a system of companies that are selling software to government so that you don't have to do the traditional RFP process.
Right. Ron, one of the things that came out a little bit, some of the questions earlier in the day were about the difficulty of accessing the data, right? Trying to get data out of the state. The state sits on troves and troves and troves of data, and very little of that is accessible. But your organization actually is in the business of, as you said, making it available for free for use or sale. And I think that or sale is a significant distinction. Personally, I think that because OSHPD doesn't have a programmatic role, that helps. And this is a case where organizational design drives your willingness, right? You've sat in various chairs in state government. What is it about OSHPD that is different than the Department of Public Health, the Department of Healthcare Services, the Department of Justice, these other agencies that have data that are less accessible?
Well, they were designed to administer a program, the Medi-Cal program, the Department of Managed Healthcare, mental health services, alcohol and drug programs. OSHPD's creation was with the intent to make our data available. And I did not mention that the confidential data are available for free to California local health departments, all of the hospitals in the state, and if you're a university-based researcher and you go through the protocols and get approvals, it's available to you. But the law that created us was unique in that regard. And before I went into state government and public service, I was a journalist. So for me, this is really a close to the heart in terms of information and getting it out there. But it really is unique in the state's government infrastructure. There are departments that are trying their best to try to get it out there, but they really struggle. The old IT systems make it difficult. Their mandates make it difficult. All sorts of interoperability issues make it difficult. So we're small. We have a different kind of statute authority, and we haven't had a data breach in forever, as far as I know. So we're very unique in that regard.
Can I ask a follow-up to that?
Yeah,
I'm just
absolutely.
curious. So you had mentioned that it's either for free or for sale. Like, what's the rubric or kind of, how do you decide what's for sale or what's for free?
Well, when I say for sale, it's at our cost.
Okay.
So it's not like we're making a profit, and it's a couple $100s for most of our data sets, but really a lot of them are for free. So it depends if you're a nonprofit or a for-profit, the volume of records that you want. There's all sorts of things that are considered, but and if you're a nonprofit, it's often even cheaper than that. So
One of the sort of untold secrets of government sector is very rarely are there really solid prohibitions on doing things. There are often prohibitions. It's usually a question of what's the path to get there. So the state can provide access to otherwise confidential data to a university. Well, the university can enter into an MOU with a nonprofit. So sometimes how you ask the question, building that partnership actually can open up access. That's true for OSHPD, but it's also true for other departments. I think you heard earlier that the work that was being done around child welfare data, that's been worked on over a long period of time. Okay, I want to ask one shift just a little bit, and then I want to take some questions from the audience. So, what we've seen is there's this significant diversity. There's a spectrum of public sector involvement with data. You've heard about cities and counties. There are some state agencies that are engaging. A lot of sites that whether it's Boston or San Francisco or OSHPD, we've seen. It's not true to say government is not data friendly, but it's also not true to say government is data friendly. There's this tremendous amount of diversity. Are we ready to explore the idea of creating some incentives, some recognition for those public agencies that are really pushing the envelope? There was a discussion earlier around what the private sector, some of the health payers are doing in terms of providing a benefit or taking away a benefit to incentivize behavior. Would that model work with public sector agencies as well?
Just to jump in, I think definitely. I think what we're seeing right now is there's a lot of interest and enthusiasm behind open data. What hasn't happened is a clear articulation of what are the things you need to do? Like, what are the 10 things to say, all right, we're doing these 10 things, and that means that we're open data friendly, right? We don't have that criteria yet. And I think as a community, that's what we have to align on. Because once we have that, then we can have a real conversation. All right, I'm from Centralia, Illinois, a small little town. There, you want to do open data? All right, you're doing these 3 things well. You need to do these other 7 things. We can't have that conversation right now because we haven't had those set of criteria aligned. And I think once we do, then we can start setting incentives for moving forward.
But until we get to a space where we can build these really solid incentives, it still does play out as relationships. It does build also this question of trust. One of the things that we've been doing is we're the only shop, I think, outside of the city of LA, in terms of the city family, that receives LAPD's full crime data every day from LAPD. And a lot of that has to do with the fact, it's interesting. I'm a co-director of the Advancement Project. There are 3 others in California. One of them is Connie Rice, and she's sued LAPD at least 10 times. And so you would think she'd be the best candidate for someone LAPD wouldn't trust. But when it got to a space where they were really looking at an intractable problem, they were sick of being called the gang capital of the world. And they're sick of policing that kind of space. And so the idea that we can actually create a cohesive vision and purpose that we aligned with as a civil rights organization and as the institution of LAPD, I was in those meetings and sort of really frightened because everyone was packing heat, and that's the only kind of space where you're in a data meeting where everyone's packing heat. But to get to a space where we had trust and we had alignment on our goals and our values, right, that we could then say, people were running down this hallway to get us our data, so that we would leave the headquarters with the reams of data so that we could help to analyze, create a conversation. And that was the start of an initiative that was very political in nature. It had to deal with a lot of different politicians, a lot of different community engagement, a lot of research and data, a lot of beautiful maps. But in the end, LAPD right now has the lowest gang crime levels than, since the 60s, right? Since we started working with LAPD on this stuff, we've had a 50% decrease in gang crimes in some of the areas that we've been focusing on. And that's about partnership and building real trust with the institution, and not just about more process, procedures, and incentives, but sort of really kind of alignment on purpose.
I just wanted to add one thing, which is it's not always a lack of willingness on the part of the government to play or to participate. There really are serious restrictions, and I don't want to get into all of them, but I just want to say, even a single state program may have hundreds of databases, eligibility databases, claims databases, benefits databases, just for one program. And I'm not exaggerating, with hundreds of databases for a single state program, and some of them, the data resides in the counties, depending on what the program is you're talking about. So it's not always a lack of will. It's really, there's a lot of obstacles, and I don't want to understate that, because it depends what you're trying to get and who you're trying to get it from.
Yeah, one of the comments earlier was how important it is for people who want public sector data to sit down and understand how the data are organized and gathered, and what's in and what's out in the boxes, and to Ron's point. All right, we have a couple of minutes, time for questions. If anybody has questions, we have 3 minutes, says the man with the scary gong.
He is kind of scary, actually.
Gentleman over here.
Hi, thanks so much for sharing today. My name is Roberto from here at UCSF. We found in doing work around policy related to sugar-sweetened beverage that folks have asked for impact relative to their specific electoral districts. And I'm wondering if you all have done that before to get beyond that barrier of connecting the data to what's relevant to specific elected officials. And if you haven't done that before, are you interested in doing that type of thing, partnering with folks looking to connect science and policy?
When we first started Healthy City, we tried I actually fought against when the city council would ask me to cut data by their districts. I thought it would get too much into that sort of more provincial or NIMBY or just about my space. And so we try to say, no, let's look at this as a citywide problem, let's look at it as particular communities and what have you, and that didn't work. And in the end, if you're going to play this game, you have to learn the rules of the game, and it is a political one. And so in the end, we start shifting over to saying, yeah, we're going to cut it by districts. But we're also going to understand that in the city council, where there's 15 city council members, how do we look at the data so that we see alignment of 8 of those city council members on a particular issue? So when it comes time to do the whip count on the votes, that they'll be there for you. And so you do, in the end, have to play that game. This is why I say that you have to not only have a research agenda, but a political agenda and a political analysis as well.
I would temper that a little bit, just with this recognition that, if you want to know what's going to interest policymakers, go ask them. Yeah. Because some policymakers really will drive on what's going on in my district. Some of them are interested in disparities based on race or ethnicity or gender. So it's not cut and dry.
Yeah.
It's not statewide, it's not county, it's not district. On an issue-by-issue basis, you have to do the homework on the data as well as the political capital side. Right? I think you're next here on the right.
So I wanted to ask about the creation of OSHPD. If I understood correctly, this was via legislation that was unique, or at least relatively unique, in wanting to make data accessible. is there any usefulness in thinking about that as a framework for other agencies or departments at the state to think about the ways in which data could be usefully made public? For legislators to think about, OSHPD as a model in some sense?
Well, we've been getting busier, I think because people know about us, and that's great. The legislature is looking at this year, giving us a variety of new kinds of mandates. So it's really up to the legislature or who's in the governor's office at any point in time to sponsor legislation. And I mean, yeah, there's been a variety of things that have been looked at over the years. Right now, there's nothing, significant on the horizon, but you never know what the legislature might do at any moment. So,
One quick last question, and I think let's wrap up after that.
A quick question. A lot of forward-thinking local governments really think a lot about transparency and are doing really well with transparency and openness, and even putting police, fire. Seattle is amazing. They have all the responses to calls to 911 fed live with a short delay. Could you briefly address the interest of policymakers in transparency?
I think what we've seen, at least at Code for America, is that policymakers look at transparency, their interest in two ways. One, in terms of being accountable to the public, right? Particularly mayors. We're seeing mayors really step forward and say, this is something we care about, and we're going to be proactive about it. Look at Philadelphia. Mayor Nutter cares about this stuff, it seems, in a very visceral way, and is committed to doing it because this is how he thinks he should do his job, right? And then I think the other way in which you're seeing it is that it's actually helping them do their jobs better. So Seattle, to your point, by opening up crime data, you're actually enabling community groups to be able to help the city provide better criminal justice services, right? By, in San Francisco, Open 311, you have 311 data openly available. It provides people better access to those services. So I think it's really a pragmatic argument back to the initial point. One, in terms of accountability, and two, in terms of better service delivery.
Please join me in thanking these three gentlemen for coming out on stage today.